In this lecture, we will discuss about the muscles of the anterior abdominal wall. The anterior abdominal wall consists of multiple layers of muscles that protect abdominal organs, assist in movement, and maintain posture. They provide structural support to the trunk. It facilitates breathing, and actions like coughing, sneezing, and defecation. The anterior abdominal wall consists of following 6 layers, arranged from superficial to deep skin: superficial fascia, which is made up of Camper's fascia and Scarpa's fascia, muscles and aponeuroses; transversus fascia, extraperitoneal fat, parietal peritoneum. Let's have an overview of anterior abdominal muscles. It consists of following 5 muscles: external oblique muscle, internal oblique muscle, transversus abdominis muscle, rectus abdominis muscle, pyramidalis muscle. We will discuss them one by one. Number 1. External oblique muscle. It is the most superficial of the abdominal muscles. It originates from the outer surfaces of ribs. From 5 to 12, it is inserted into linea alba, pubic tubercle, and anterior half of the iliac crest. Direction of fibers is in the inferomedial direction. This looks like a hands in pockets orientation. It compresses the abdomen, aids in trunk rotation and lateral flexion. Clinical note: it is important in surgical incisions and hernia repairs. Number 2. Internal oblique muscle. It is present beneath the external oblique. It originates from the thoracolumbar fascia, iliac crest, and inguinal ligament. It is inserted into ribs 10 to 12, linea alba, and conjoined tendon. Direction of fibers is in the superomedial direction. This is opposite of external oblique. It compresses the abdomen, aids in trunk rotation and lateral flexion. Clinical note: it forms part of the conjoined tendon, relevant in hernia formation. Number 3. Transversus abdominis muscle. It is present deepest of the flat abdominal muscles. It originates from the thoracolumbar fascia, iliac crest, inguinal ligament, and costocartilages of ribs 7 to 12. It is inserted into linea alba, pubic crest, and conjoined tendon. Direction of fibers is in horizontal direction. It provides core stability, and compresses abdominal contents. Clinical note: its weakness can lead to core instability, and lower back pain. Number 4. Rectus abdominis muscle. It is located in the midline, extending from the pubis to the rib cage. It originates from the pubic symphysis and pubic crest. It is inserted into xiphoid process, and costocartilages of ribs 5 to 7. Direction of fibers is in vertical direction. It flexes the trunk, that stabilizes the pelvis. Clinical note: it is divided by tendinous intersections, forming the six-pack appearance. Number 5. Pyramidalis muscle. It is a small triangular muscle, anterior to the rectus abdominis, present in some individuals. It originates from the pubic crest. It is inserted into linea alba. It tenses the linea alba. Clinical note: it is often used as a landmark in abdominal surgeries.